Well, it's never fun to get sick, but especially this time of year. And the CDC's latest December data shows that in Illinois, the risk for COVID-19 is low, but cases are increasing. However, in Iowa, cases aren't growing, but influenza cases are rising in both states. Well, as the holidays and your family gatherings get closer, it's why Julie Caldwell, the senior manager of immunizations at Walgreens, joins us now with tips on how to stay healthy this winter. Julie, thanks for joining us. First, I want to start with why does it seem so much easier to get sick in the cold?
That's a great question, Haley. Um, Everyone starts to think a little bit more about getting sick when it does get cold. When it gets cold, we come indoors more. We are gathering for the holidays, and that's when we start to see these viral illnesses start to ramp up. Additionally, people are traveling in from different areas. So, as you mentioned, there's cases rising across the country for respiratory illnesses, including flu and COVID 19. So, folks, as they travel for the holidays, are unfortunately bringing those with them.
Well, we just shared some general data from the CDC, but what other trends? Is there one of those illnesses that is increasing more than the other? Are there certain hot pockets throughout the country?
Yes, absolutely. We're starting to see that as the season ramps up. As you know, it's been a little bit slow and mild, if you will, for activity of flu-like illnesses. But in the last couple of weeks, that's really changed. Walgreens has a respiratory index, which shows across the country how states look, making it really easy to read because the green states are clear and good to go. And those that are turning yellow, orange, and red are starting to see heightened activity, especially in the Midwest and the Northeast. Flu is particularly active, particularly influenza A. So it's really starting to be on the top of everyone's minds as they begin to think about travel for the holidays.
And how does this compare to other years? Is influenza A always big about this time of year, or is it different this year?
I mean, it can be different from year to year. That's why there is surveillance on what types of positivity that we're seeing in influenza testing. Um, the What we're seeing now is that flu is really rising faster, and from year to year they monitor so that they can improve the vaccine effectiveness. And what we're seeing now is that the vaccine effectiveness is doing pretty well. We won't have United States results yet, but in England we're seeing that there is some effectiveness for the vaccine, which is helping.
Well, you're talking about vaccines. Are there any other ways that people can prevent illnesses, these type of respiratory illnesses?
Sure. Definitely vaccines are the best way. They are the safest and most effective way to reduce complications, particularly from these illnesses, and especially for those who have other comorbid conditions. But we can always all do things to help ourselves. We can make sure that we're paying attention when we are traveling, or we're those high touch areas are being disinfected. Take the sanitizing wipes with you. Make sure that you're paying attention to your surroundings, staying hydrated, as well as covering your mouth and your nose when you do sneeze, or making sure you're washing your hands.
And maybe if you're a family with young kids this holiday season, you're going to the airport, you're going to be in and out of the car, in a lot of public spaces. What other tips do you have for them?
Definitely. First and foremost, again, just making sure with hand washing, and then, not touching everything you see and then touching your face or your mouth. I mean, we kind of go back to the pandemic days when everybody was really thinking about those things. They really do work. There's small precautions that you can take, but they do work to help reduce the spread. Additionally, you can make sure that you have some things on hand in case you do start to feel sick. So making, again, I mentioned earlier, being hydrated, making sure you have, those pain relievers or cough medications and things like that to help you reduce symptoms if you do start to get a cold or start feeling some aches and pains and things.
Well, Julie, thanks for these tips today. It's especially important in the next couple of weeks.